to see. I'll be here this afternoon. If you'd like a one-on-one, I'll be pleased to do that. What we're going to do today is go through the actual process of retiring, and I'm going to tell you what we do, how we do it, what you need to do, what you need to contemplate, the paperwork you need to bring in, and hopefully that will help you as you go along your journey from being an employee to actually retiring. So is everybody in this room actively thinking about getting a pension? If you are, raise your hand so I know. All right. For those who aren't, this is still a great opportunity to know what to look forward to, right? Because the rules don't change, right? So that it'll help everybody in here. Those who are actively, if you got any specific questions, please feel free to yell them out as we go, and we'll get through it, okay? All right, so let's talk about qualifying for benefits. Basically, there's a few types of benefits under the plan. They're based primarily on your age and the number of years of service you have in the plan. To get a normal pension, you have to have at least 3 years of service and retire after turning age 65. To get an early reduced pension, you need to retire between 55 and 62 with at least 15 years of service. If you meet the qualifications of an early reduced pension, your reduction for age, let's say you retire at 58, is calculated back to 62, not 65. Early unreduced would be those pensions you hear 25 and out and 30 and out. That means that if you have at least 25 years of service under the plan, you can retire at any age without any reduction for not being 62 or 65. That's an unreduced early pension. 25 and out, any age, you can come out, no reduction for age. And lastly, a disability pension. A disability pension, you have to meet two requirements. You have to meet both requirements. One requirement is that you have to have at least 15 years of service. The other requirement is that you must have been determined to be permanently and totally disabled by the Social Security Administration. All right? Any questions about that? You have to meet both requirements. What's important about a disability pension is that you can get if you qualify for a disability pension, you can get a disability pension at any age with no reduction for age. So a person that is 43, a person that's 43 is not eligible to get a pension unless they have 25 years. But let's say somebody at 43 had 15 years. The only way they could get a pension from us without waiting until they at least turn 55 would be a disability pension, okay? So how are the pensions paid? And we're going to go over this sheet in a minute. If you're entitled to a pension, regardless of the pension, they're all paid in one of these manners. You can get your pension as a single life annuity with 60 payments guaranteed. You can get it as a regular annuity. That means you get a monthly amount every month. You can get the joint and 50% survivor annuity, the 75% joint and survivor annuity, or the 100% joint and survivor annuity. The differences between the survivor annuities, 50, 75, and 100, really turn on what the surviving spouse gets. A joint and survivor annuity means that the pension is paid for two people. The member gets a certain amount during his or her lifetime, and upon the member's passing, the spouse, as long as the spouse is surviving, gets a benefit for the remainder of their life. In the case of a 50% joint and survivor annuity, the remaining spouse or the surviving spouse will be entitled to 50% of what the member was getting on the date of his passing. If you were eligible for the 75% joint and survivor annuity, that's what you elected, your spouse, surviving spouse, would get 75% of what you were getting on the date of your passing. And if you elected the 100%, that means that your surviving spouse would get 100% of what the member was getting on the date of his passing.
If she passes or he passes first, what happens then? Does your pension go back up to where it was in the annuity, or does it stay the same?
Good question. The question is, it's called the pop-up benefit. And only in the case currently of the 50% joint and survivor annuity does it pop back up. So what a pop-up benefit is, as this brother indicated, is the benefit that I elect the 50% joint and survivor annuity upon retiring, which means that if my wife survives me at my passing, that she would get 50% of my benefit for the remainder of her life. Unfortunately, my wife passes before me. That means that if my wife passes before me, my benefit would pop back up to what I would have gotten had I not been married. To demonstrate that a little more fully, can everybody grab the sheet? Everybody's got a sheet? And I want you to go to the part on the, so let's just go through this really quickly so I can give you an example of what I just explained. So if you look at this sheet, this is what everybody would get when you retire. This is a calculation sheet, and this sheet would have your benefits on it, right? So in this case, you have a member who has 43 and a half years. So go to the calculation information section. The benefit is $3,175.50 a month, right? Member worked long and hard. Everybody see that? All right. So now go to the section where it talks about optional forms of pension benefit. When we talk about the forms of payments, the life annuity, as indicated there, is $3,175. That's the full pension. The 50% survivor, the option is for $2,904.31, with the wife getting, or the spouse getting, $1,400. The 75% is $2,700, with the spouse getting 75%, or approximately $2,100. The 100% is the member gets $2,600 and the spouse gets $2,600. Here's where the pop-up matters. Everybody can see where as the amount the spouse gets upon passing, the amount that the member gets goes down, correct? So what that means is that when we provide the benefit, the 50%, the 75%, or the 100%, you're paying for it. So that reduction in your pension amount is the amount that we're going to sort of withhold to fund the spouse's benefit, right? Any questions? So what this member asked is, so what happens? Now you're taking my money, right? Because I took the 50%. I was supposed to get 3,175, but you only paid me 2,904, right? Because I'm going to provide that 50%, but now my wife passes. There's nobody to pay. Under the plan, the survivor's money doesn't go to your kids or to your pet. Nobody else can get the money but the surviving spouse. If there's no surviving spouse, that's it. What the pop-up benefit is, the pop-up benefit says that if my spouse passes before me and I'm getting the 50%, my monthly amount, effective the first day of the month after the death, pops back up to what I would have gotten had I not been married when I went on pension, which would have been what? Exactly, that's the pop-up benefit, okay? That's how that works. Now, note please that the pop-up benefit currently does not apply to the 75% or the 100, right? So if you take the 75% or the 100, it's a great benefit, but if your spouse passes before you, your benefit would not pop back up, it would remain the same. That's just the way the plan works currently. A good question, okay? Any more questions about that? All right. All right, so this is a little bit what we talked about. If you're married, what federal law says is that the 50% joint and survivor annuity is the normal form of payment under the plan. And what the normal form of payment means is that that is the benefit in which we must offer you first. So if you're married, and I I've done this job for 35 years, and I have this argument at least twice a week about members who say, they didn't work for my pension. Why did they get anything? And I go, can't tell you, champ, but I know what the law says, and the law says that the pension must be paid as a 50% joint and survivor annuity first. So go back to this paper, and if this member came into my office, the first form of payment, if they were married, offered would be the 50%. And they would go, they don't have the option to take the 3175 if you're married. You don't have the option to take the 75%, and you don't have the option to take the 100% until your spouse lets us know, yes or no, whether they want the 50%. Your spouse must sign a waiver form which says, I have been advised of my rights. I know I am entitled to, on this form, the amount of that $1,400 should my spouse pass before me, and I don't want it. If they sign that form that says basically, I know my rights, but I elect and give my consent to waive it, then at that point, then the member is allowed to take either the life annuity or one of the other forms of payments. To the spouses in the room, if you sign that form, which is ultimately the decision of your household, please note that the member is at that point allowed to take whatever he or she wants. And there's nothing the fund can do, right? So when you get these options, you must take them seriously because again, if you sign off on it, there's a strong possibility that should your husband or wife pass before you, you might not get anything. All right? Now, if the wife does sign off, the spouse signs off, there are options under the plan that's called the 60-month guarantee. And it's for single people, if you have at least 15 years of service, you'll get what's called the 60-month guarantee. And what the 60-month guarantee is that, so if you're single, you have at least 15 years of service, you'll get a life annuity with 60 months guaranteed. And what that benefit is we'll pay you for the rest of your life. And should you pass before you get your first 60 payments, we will pay your designated beneficiary the balance of those 60 payments. So member single, or even in a situation, married member whose wife signs off, whose husband or wife signs off, they're entitled to take that too. So that's what I'm saying. And if a married person who's had their spouse give their consent takes that 60-month guarantee, there is no obligation or requirement that the member name the wife as the beneficiary. Because once the wife gives her consent to waive the normal form, that's it. Whatever they put in that paper is on that paper, okay? So the 60-month guarantee works like this. Member goes on pension, guest has a 60-month attached to the life annuity, member gets 20 checks, unfortunately passes away, member's beneficiary is entitled to the remaining 40. 20 plus 40 equals 60. At the end of the 60th payment, the pension ends. Member goes on pension, passes away, and on the same day as his 61st check, nobody gets anything because we paid the first 60. Okay? Any questions? Yes.
Go ahead, Chris. So you have the annuity, you're married, you get divorced. What happens?
You have the annuity and you get divorced?
You get divorced.
Well,
And they didn't sign.
you keep it. So one thing, that's a great question. What happens if you are going pension, pension annuity, and you've opted for the 50% joint and survivor, or the 75% joint and survivor, or the 100% joint and survivor? Pensions are sort of like your mortgage, right? Like once you sign for the house, you got the house. You just can't go, you know what, never mind. I changed my mind, Wells Fargo. I don't want the house anymore, right? Your pension is the same way. Once you sign for the pension, whatever you sign for, that's your pension. So if you've taken a 50% joint and survivor annuity and you subsequently get divorced after the pension commences, you're still married to us. Because what we care about is your status on the day your pension became effective. That doesn't change. A lot of members get upset because they're now divorced and they go, well, will my spouse get that 50%? And the answer is yes. And what if the spouse remarries? The answer is yes. Because it's what your status is that day. It didn't change. Because keep in mind, as you indicated on this piece of paper, we've calculated these numbers. These numbers were based on your age, your spouse's age, how long we thought you'd live, how long she thought you'd live. We're done, right? So once whatever you sign for, that's your benefit. Okay?
Thank you.
You're welcome. Thank you. Good question. Any more questions about this? All right. So we went over if you're married when you're retired, you will be offered the 50%. That's the pension you have, unless your spouse gives his or her consent to allow you to take another payment. If that doesn't happen, you have the joint and survivor. Yes.
Does that, say if you get married for the first time and you get divorced and then you get remarried, does that still applies to the first marriage? Okay, so the next spouse that you get married with won't benefit from that. The first one will. Okay.
Right.
Good.
Right. One and done. Right. You know what I mean?
Okay,
That's how it works. That's how it works, right? In reality, that's how it works, right? All right. Any questions? I'm sorry. Yeah, exactly. I said, the second one's gonna be mad, but I don't know what to say. Yes, ma'am.
So I do have another question. So you did mention that you're, whatever you set up, that you're married to that, but what if you get married and before, like, I've been working here for 12 years and I get married.
And your pension hasn't commenced? All right, so great question, and low. All right, so for those folks who are like kind of mid-career, like they're not quite retiring yet, if you're not married, the way the law reads is, in order for us to offer a spouse to J&S, you must be married for the 1 year period ending on the effective date of your pension. So if you've only been married for 3 months, we won't offer your spouse to joint survivor until you've been married for a year. But if you're married for a year, we're gonna offer it to you. So a lot of people will say, I've been married for 13 months. I don't know what to tell you. So you kind of got what you got. So some of those things probably, as you sort of think about retiring and you think about your current status, you may want to contemplate as you go through your process, because if you come to the door, we're going to do what the law says, right? And that's in the pension we calculated pursuant to the rules. That's it, okay? All right. In the plan, and they're talking about increasing this currently, if you have 15 or more years, they're thinking about changing that to so everybody gets a little something. There is a $5,000 lump sum death benefit. We'll talk a little bit about this later when we talk about health care. So we'll get in front of it. The $25,000 that everybody knows about is a health care benefit. It is not a pension benefit. So when you retire, you stop working. And we all know that health care is accrued based on the hours you're working in the field, correct? So when you retire, and you're no longer putting in hours, eventually your health care will terminate. It just will. And when your health care terminates, that $25,000 goes away too. So at some point after you retire, you will not have life insurance, at least that $25,000 that you currently have through your health plan. So as you contemplate retirement, you want to sort of also think about any life insurance needs you might have if you were counting on that $25,000 being a policy available to your family to manage your final arrangements. All right? There is a $5,000 lump sum death benefit that's available in the pension plan. That's payable to certain types of, if you've got 15 or more years of service. The eligibility requirements are in a slide. They're in your notes. If you have some questions, I can answer them afterwards. The $5,000 lump sum death benefit is not a marital benefit like the joint survivor, which must go to the spouse. The $5,000 can go to anybody. So if you wanted to leave the $5,000 to your children, you could. That's up to you. One bit of advice I would tell you is $5,000 is not a lot of money. There's some taxes on that. Please don't leave it to 15 kids, right? I know people that come in, they want to leave it to Bob and Mary and Jay because they want everybody to have a little something. Well, it's a mess because when there's a passing, that means that 15 people have to come in and 15 people have to fill out applications. And I would also tell you that if you believe that your family will need some of this or all of this money as proceeds for final arrangements, you don't want to leave it to minors because they can't do an assignment. You don't want to leave it to 15 people because all 15 have to agree to the assignment. You want to leave it to the person, one person that you think will do what you want them to do, which is take the money and manage your end of life arrangements, okay? So please, every month we have somebody leaving, $5,000 to 10 people, and then they go, we want to assign the benefit. All right, all 10 of you now have to sign this form, right? And then they argue, and so it turns into a bit of a mess sometimes. So just think about who you want to leave the money to. I encourage you, if you can't, only leave it to one person. Even if you start leaving it to 2 or 3 people, it can get messy at the end. All right? The pop-up benefit, we talked about. Any questions about the pop-up benefit? All right? Okay, so how do I make a claim? All right. Those who want to retire can either call us and we'll mail you an application, or you can come to 665 North Broad Street, 2nd floor, go to the pension department. They'll provide you with an application. What you need to have with your application when you file it, you need your marriage license if you're married. You need your birth certificate. If you're married, your wife's birth certificate. Your social security card, and if you're married, your spouse's social security card. If you are divorced, we need your not only the order, which says as of this date, you're released from the bounds of matrimony, but we need any settlement, any order that you have that has the distribution of marital property. That is important. That will hold your claim up, because what we need to know if you're divorced is that you didn't split the pensions and that there is no quadro coming, right? So if there's a property settlement, we need it. Some members don't give it to us. We hold up their money, and lo and behold, guess what they have? The property settlement, all right? And that will hold your pension up for months. So we need that too. If you don't have it, and you know there is one, you can get, if you got divorced in the County of Philadelphia, you can get it from City Hall, or maybe you can call your old lawyer, they would have it. But we will require that we give that. If you've ever been on disability or workers' comp, any of that paperwork you want to include as well.
If your divorce is no contest, are you free? Are you free and clear?
It really depends on what the language is. Now, sometimes, I'm going to tell you, sometimes if it's very vague or if it's unclear, we will send a letter to the former spouse and you say, listen, our understanding is that there is no divorce settlement, there is no obligation to you for the pension, and we ask them to sign off. Because what we want to do is we want to be sure that we don't pay the member, and then 2 years later, we have a former spouse come in and say, here you go, I was supposed to get half the annuity. Because the member is not giving us back half the annuity. They're not going to say, here you go, here's the money back part here. That's not going to happen. So we're going to end up almost probably having to pay twice and probably having to do something with the member.
Wait, you would need a signature. I would need a signature from them.
Well, yeah, it depends on what the order says. If the order was clear, we'd probably be okay. But if it was vague, then we would probably write. And we have ways to deal with situations where they won't answer or there's it's not the best situations. But we would probably ask at least he confirm that that's how you guys ended the marriage. All right? Any questions? All right. All right, annuity distributions. The annuity works the same way as the pension. All right? When you get your annuity paperwork, and a lot of people are astounded by this, I'm gonna tell you now, if you're married and you want a lump sum or you want your annuity in any other form of benefit, and we'll go through them, your spouse must first sign off the 50% joint and survivor annuity. Right, so if you go back to this calculation worksheet, this member has about $400,000 in his annuity. He's married. The first thing we do is say, well, sir, your wife must tell us she doesn't want the $1,338. And then once the wife waives the 50%, then the member is free to take the annuity and any form of payment we offer, which range from not a cash payout, but a payout directly to them, subject to the appropriate withholdings, a rollover. There you can take it as a partial rollover and a partial direct payment, or you could take it as a life annuity, or you could take it as a certain and continuous. So one of the options is once your spouse signs off the waiver, you can have your annuity paid to you anywhere over 12 to 180 months. So there's a bunch of different options within the annuity distribution framework, but the first one, if you're married, is your wife must sign the waiver form for the 50%.
When does that happen? When does she have to sign it? Like, my last date was the 29th of December.
Okay.
I processed all my paperwork, and it's then just waiting for it to.
Okay, so your next step is, when did you submit your application?
The
Back
29th of December.
Oh, that's where you
I
submitted
mean,
it.
I submitted, but I had to go back down, but my stop date was the 29th.
Okay, so they're probably processing your application this month or next month. All right, that's a great question. So what'll happen is when you apply for pension is you'll go down, you'll submit your paperwork. What happens is we get your application. The first person to get your application opens it, they see what you have. They go through it, they make sure we got a birth certificate, we got the wife's birth certificate, we got social security cards, we got everything we need to process the claim. If we're missing anything, you will get a letter back from us saying, hey, we got your application dated, whatever. You are missing 4, 5, or 6 things. Please submit it. We won't do anything until you submit this stuff. Then you submit the stuff, the application is ready to be processed, someone processes the application, and we make the determinations, right? We tell you we actually do this. Then you will get in the mail 2 sets of election forms. One will be for the pension, one will be for the annuity. Each election form, which is a lot more than this, a couple pages, basically outlines what's on here. It'll tell you, this is the joint and survivor annuity, this is what you get. If you don't want that, this is what you can take, and there'll be election forms, and you'll select what you want. If you're in the office with us, we will countersign. If you do this away from us, you must have those forms notarized. So to answer your question, the next thing you can expect from us are those election forms.
All right, because all my forms are in, all my paperwork.
So they're processing this now. They're telling. So the next thing we'll tell you, well, this is what you're going to get. At that point, that is when you and your family will have to determine what your wife's going to can give her consent to, what she's going to waive, what she's not going to waive.
Now, if I come down to the office Then I don't have to have it notarized because I'm doing it directly in front of you.
Well, but you're gonna, don't forget about your spouse now. I'm just watching you, all right? See, he was talking a little quick, wasn't he? He was like, if I come down to the office, yeah. yeah. He was like, you ain't say nothing about hot, Mr. Parham. All right, so when you'll get a letter from a young lady named Janice Burrows. When you get your letter saying we're ready, you'll tell Janice, I want to come in. And then you'll bring you and your wife. You'll both come in, you'll sit in the conference room, she'll bring the forms in, she'll fill it out, she'll sign, you're done. All right? Okay, just kidding. All right. Any more questions about that? All right. He wasn't kidding. All right. All right, health benefits. All right. I just had a long talk about something about the health care. All right. As I said before, your health care is determined by hours worked, right? Retirement is a cessation of employment. So when you retire, eventually your hours will stop and your benefits will end, right? In some cases, you have, okay, so the different scenarios. If you retire after you're 65, all right? And when we say retire, we don't mean after you're 65, we don't mean stop working when you're 48 and then come back when you're 65 to get your pension. That's not retirement at 65. That's retirement at 48. And you're coming back to get your money at 65. Retirement at 65 means that you stop working after you turn 65, then you retire, right? And in those situations, if that happens, then, and you're eligible for health care, when you retire on your 65th birthday, we offer you a Medicare program for you and your spouse for the remainder of your life. Only if you retire after you're 65 and you're eligible for health care. So what is the Medicare program? The Medicare program is a Medicare Advantage program. We offer it to every retiree meeting those requirements. And your spouse is eligible to participate as long as they're 65 and have Medicare Part A and Part B. So if you're in that situation, if you're 63 and you're currently eligible, or 64 and 8 months, don't retire until you're 65. A lot of members that come in and go, I was, because they were trying to get the back, I'll be honest with you. Even if you're gonna lose a couple months retro, if you're 64 and 8 months and you know you're still gonna have coverage and you can get into this program, you wanna give up them 4 months. But a lot of members try to get the retro and they go, well, I'm 65 now. And I go, no. You were 64 when we paid you. So what we look at is the first date in which we pay you, not what you are today. So the way the Medicare program works is you retire meeting that condition. We will, once the Health and Welfare Fund is notified by the pension fund that you've retired, we will send you a letter basically saying that, hey, you're entitled to this Medicare program. We remove you from the active program, all right? So it's a lot of stuff going on in the field that says, if I'm 65, I get my benefits forever. Well, no, you don't. What you get is, if you meet that situation, you get the Medicare benefit forever. You don't get the active coverage forever. So if you meet those requirements, we would take you out of the active plan, meaning you lose IBC and Express Scripts and Fidelio. You don't have that anymore. We put you in our Medicare plan. And it's the Medicare Advantage plan. You have that for the rest of your life. All your benefits except for vision would come through that program. So you would get medical through them, prescription through them, whatever dental they offer, you would get through them, but we would still provide you with vision care. In order to be in that program, you must have Part A and Part B. So if you're around that age and you're thinking about coming out at 65 and Medicare contacts you, take Part B. We cannot put you in the Medicare Advantage program without Medicare Part B. So take it when it's time to take it, all right? If your spouse, go ahead. Oh, good, what's your question?
I'm sorry, I wasn't I heard you correctly, you were saying B?
You need B. Remember, when you go on Medicare, you get Part A automatically, because that's the hospitalization. The part you have to pay for is B. But B is, the diagnostic part. B is, office visits, specialist visits, imaging. It's all that stuff. So really, Medicare is not a great benefit without the B anyway, right? You can't get into a Medicare Advantage program, even if it wasn't ours, without B. So you need B, right? And what happens sometimes is members who continue to work after they're 65, even though they get put in Medicare Part A, they don't take the B. Because they say, well, why should I pay for the B now? I have coverage. And then we tell them, well, we can't put you in this program until you get B. Then they have to go back to Medicare, tell Medicare to put them on B, and sometimes there might be a waiting period, or sometimes they'll make you pay a little more for B because you weren't on it from 65 up until the time you want it. So if you're close to 65 now, and you're thinking about coming out, take the B now. Right? Oh, you still got a question? Yeah, I don't think I got it.
No, I have it.
You good?
Yeah.
You sure? All right, okay.
So you say take B early?
No, you can't take B early. What some members do is when they turn 65, they don't take the B. They just let Medicare enroll them, and they'll go, I'll come back to B later. Then when they actually retire, a year later, they might meet these requirements to get the our Medicare Advantage program. And then one of the things, when you'll get a letter from us saying, hey, you qualify, we need you to fill this application out for the program, and we need your Medicare card. Your Medicare card must have A and B on it. And then they'll go, well, I don't have B. And we'll go, well, you can't be in the program. So until you get B, right? And then they got to go back to Medicare, enroll in B. And sometimes I've seen situations where it's easy, and I've seen situations where they want to make you wait 6 months to get into B. So it really depends. Yes, ma'am.
Is there for the Part B, is there a standard cost for what it costs? Is that,
No, I think, and it might, well,
or does it depend, or like, is there like a selection?
it depends on your income. So B is driven by, when they calculate your B premium, it's driven by how much money you made over I think it's a 3-year rolling average. It's some kind, I don't know the number of years, but it is based on your income. And so what'll happen is if you had a couple good years before you take B, your B premium is going to be high. But over time, your B premium will start to go down because every year, I think they calculate it again, but they calculate it based on the last 3 years. So eventually, when those high years are out of your 3, your B should start to come down. Like I've seen very high Bs, and I was like, God, that's a lot of money. But it's because for the last 3 years, they made a lot of money.
Well, is that, because somebody mentioned something to me, I really haven't looked into it or put a lot of stock in it, but they said, she said to me, she's recently gone on Medicare, and she said that, did they tell you that they take that payment from your Social Security? Did they tell you that?
And that's what they do.
Yeah.
You pay for it.
Yeah.
No, B, you pay for it.
They take it out of your Social Security.
Yes, they do.
That came as kind of a shock.
Yep, they take it, yep. Yeah.
If you don't take Social Security right away, then
Well,
what?
it doesn't matter because Medicare and Social Security in this context are different. So you can continue to work. You never have to take Social Security, well, not never. You can wait till whatever your normal retirement age for Social Security, which is 67, 70, 114, whatever it is now. But you're eligible, because every year they change it, right? Yeah. You just keep on, Yeah, for Tisha, it's gonna be 120, right? Because it's been 67, now it's 70. So, but to answer your question, you're eligible for Medicare at 65 regardless of whether you take Social Security. You're also, but the issue is B. And when you become eligible at 65, they want you to take the B. Because their issue is it's not fair for a person not to pay for the B for 2 years and then come in, get B, and then have a lot of claims. Because the person that took B at 65 has been paying into B for 2 years. Now, there is an exception if you have employer coverage. They'll say, well, if you were covered by another plan, then you didn't have the obligation to take B. But you got to come down to the office, fill out paperwork. So I would tell you, if you're retiring pretty close to that 65, and it might be 1 or 2 months you pay without, take the B. It's just easier to take it when you're supposed to take it as opposed to waiting. But that would be up to you. Yes, ma'am.
Okay. Scenario, I'm getting ready to retire. I'm gonna apply for Medicare. I'm gonna elect for the B. My spouse is already on Medicare.
Right.
Once he becomes part of my Medicare Advantage program, he will no longer have his B deducted from his Social Security check?
No, I think B is B. And the only difference is that, like, you're going to pay for B. The only difference is that we're going to enroll you into a Medicare Advantage program and pay for it. So if he wanted to be in his own Medicare Advantage program now, he would still have to pay for B. So no matter what, if you're on Medicare, you're using those services, diagnostic services, specialist services, x-rays, you have to have B. So no matter what Medicare Advantage program you're in, no matter who's paying for it. The benefit of the Medicare Advantage program is we pay the premium. So when you watch TV late at night, you see Humana, you see all those commercials, and we're paying that premium, right? So our current premium is about $300 for everybody in that Medicare Advantage program, right? But it's all inclusive. You have, like I said before, you got a lot of benefits. The copays are good. The prescription copays are the same as what you pay now. The hospital copays are about the same, so it's a good plan. But you still need to take B.
No, I understand.
Yeah.
I need to take B.
So does he.
I would elect for. My question is, he's paying for his B through his Social Security check. Once he becomes part of, since he's on my health care,
He's got to pay B.
he'll still have to pay for his.
He's still got to pay for him. No matter what, you're going to have to pay for B out of your Social Security check, and he's going to have to pay for B out of his. We're going to enroll you in this Medicare program. Your husband's going to get a card that says IBC Medicare Advantage, and you'll get a card that says IBC. And whatever Medicare and IBC do in terms of the coordination, they're going to coordinate it based on your individual SSNs. They're separate accounts in essence. Okay. Any other questions? I'm sorry, bro. You gotta pay. All right, any other questions? All right. Oh. All right, the other retirement healthcare benefit. All right, you thought that one was long, get ready. All right, so let's say you retire and you're not 65 yet, right? You're 50, how old are you?
60.
Say, good enough. You're 58, right? You're 58, right? You're not 65, so you're not going to qualify for that Medicare Advantage program because you're just not 65. But you're 58, and you retired 15 or more years of service, right? So keywords are you have to retire with 15 or more years of service and be at least 55. In those situations, the way that your health care would work is you would retire, you would stop working, obviously. You would get to keep your bank, right? We all know what the banks are, right? You would keep your bank up until you lose it, right? Then you would be offered COBRA. And if you chose to, you would pay COBRA the good news is that for these retirees, the fund subsidizes the COBRA rate by 50%. Right? So once you lose your eligibility and we offer you COBRA, if you want to take the COBRA, you can, and we would subsidize it by 50%. So if the COBRA rate was $500 for single or $1,000 for a couple, you would only have to pay $500 because we're subsidizing. At the end of the 18 months, which is the COBRA coverage period, your coverage would enter the COBRA, and if you wish to, you could continue to self-pay at that same rate up until you were 65. Then at 65, you would have to go on Medicare. You would not be eligible for that Medicare program, but you would go on Medicare and you would kind of be on your own. So for retirees who retire with 15 or more years of service and are 55 or older, there's a self-pay option, and the benefit is really the subsidization of the COBRA. So you'll have to pay, but we will subsidize your COBRA rate by 50%. Go ahead.
What if you don't have maybe 15 years of service? Are you still, if you opt to retire, are you still entitled to, so it's nothing?
So if you had 12 years and you were 56, you would meet the 55 rule, but you wouldn't meet the 15 rule. So what would happen is you would still keep your bank, you would still roll that out, and we would still offer you COBRA because that's statutorily required, but there would be no subsidy. All right, any questions? All right. We talked about the post-65 and a little bit again about the life insurance. Again, the life, that $25,000 everybody hears about, that is a life insurance, that is a health and welfare fund benefit. Once your health and welfare benefits end, even if you're on COBRA, right? Even if you decide to pay COBRA, whether it's subsidized or not subsidized, that $25,000 is not in COBRA, right? You're not paying for that. It ends. So one thing you want to do with Mike and I think the other gentleman, hopefully they talked a little bit about life insurance. You want to think through if you need to replace that $25,000 before you retire and before you lose your health and welfare coverage, you probably would need to have worked through that. Prepaid legal. If you currently have prepaid legal before you retire and you retire to be eligible for prepaid legal fund benefits, please note that prepaid doesn't have a bank. It doesn't extend the hours. It doesn't have a retiree benefit. It is. So if you once you lose your prepaid legal benefits, we're done. If you're not putting in more hours. So if you got to use them before you retire, I suggest you go ahead and use them. Yes, ma'am.
What is your bank?
Oh, the bank for health and welfare is, the plan permits you to accumulate extra hours. And currently you can accumulate up to 450 hours, which is one benefit period in essence. So I think anything worked over 600 hours in a period is added to your bank. Your bank caps at 450. And what you use the bank for is in periods in which you don't either have enough hours to make the requirement or you have no hours. So what happens is most retirees have enough hours to keep them through the current period or maybe even the next. Then they use their bank. And then once they use their bank, the eligibility ends because there's no more hours. Okay? All right.
If you got the hours in this bank, how long could that run?
Well, right now, the most you can keep is 450. So that's 6 months, right? So let's just say you work 6 months. So that's the basic example. I mean, it could get a little more complicated than that, but in general, you would keep your coverage the benefit periods you're in, right? And if you're still working, right, let's say you worked enough for the next one, at actual hours, and then you would use your bank. So you could keep your coverage going depending on your hours and your bank for 6 months, almost a year. All right, any other questions? So that was my last slide. So Does anybody have any additional questions about retiring, your health care when you retire, the annuity, how you get your annuity, taxes, anything? All right, then. That was very good. All right, so with that, I'm going to close my remarks.